South Valley Primary Care Network, 82,000 patients, 10 practices across the east of Coventry, a couple of pockets of distinct deprivation, so Henley Green, Wood End, and then the Woolen Hall wards. So a relatively deprived population overall across our 82,000 patients. We put forward a project around our type 2 diabetics. So the particular cohort we've targeted for this personalised care approach are 20 to 39-year-old type 2 diabetics with BMI greater than 30. And the reason for that choice is when you looked at across the range of long-term conditions and health outcomes, diabetes was one there was greatest variation, particularly in some of our pockets of deprivation. And the reason for the sort of BMI and the age profile chosen was it was felt that was where there's the greatest opportunity lied, but also the greatest kind of gap in understanding in some of the social determinants around their care. And we also have a fairly well-established and successful social prescribing team, and they also identified that age cohort as the one where there's the greatest challenge across our patches, particularly in the more deprived wards. So we've been running, in terms of actual mobilisation and running a project, we're about 6 weeks in now. The total cohort of the 84,000 patients that met that criteria I just described to you was 170 patients. So the total cohort size is 170 across our primary care network. In terms of the sort of run-in to the programme, we used predominantly resource and some additional resource within our social prescribing team, but they required a degree of upskilling. So there was the personalised care training that they all received, but we also delivered some diabetes specific training, both from clinicians within our primary care network and their specialists, but also some pharma sponsored, so Novo Nordisk sponsored consultant led education, just so that those having we've ended up calling them guided conversations with the diabetics had familiarity with the condition and we're able to have an intelligent conversation with those individuals. So, part of the lead-in. So when I talk about 6 week delivery, I'm talking about the 6 weeks kind of post that training. The initial sort of 4 to 6 weeks was spent upskilling, ensuring personalised care training had been delivered, and diabetes-specific training. And I think, as we produce some of the more formal reports, that's one of the areas I think we'll identify as one of the key determinants of success. I think that preparation time is very well spent, and it's enabled our team to have much more confident conversations with the patients as they've engaged with them. All this has been recorded within EMIS, our clinical system template, because again, I was very, very keen that we use this as a bit of a kind of showcase project and use it to inform future work and management of long-term conditions and chronic disease management. So very keen we have sort of baselines, then the kind of intervention stays, if you like, the guided conversations and whatever referrals result from that, and then an evaluation point. So what has been really important is that we are able to robustly capture the information and data. The progress to date of the 170 cohort, 85% have been contacted so far, so 145 patients. And when I say contact, I mean a direct contact, as in a conversation. And so the way from the start, we kind of invited patients to participate with this. My experience these days in practice is patients respond far better to a text message than a letter. Letters seem to get ignored and or put in the bin. So we did a bit of a pincer movement on our patients, recognising the slippery nature of 20 to 39-year-olds, and they did get a letter by snail mail. But then also we've got Accurex now, so we can attach PDFs of letters. We text them a PDF attachment of the letter, and we sent them a text with a link through to a bit of an information page we created on our website. So we didn't rely on any one means of communication, and that was then followed up with the phone calls. So then on to delivery, we're very fortunate in South Valley Primary Care Network. We've got a social prescribing team of 5 with a full-time embedded CPN as a kind of partnership with the Coventry Warwickshire Partnership Trust. They are hosted in a community venue, the Henley Green Community Centre, and we've got quite a decent sized office space there. There's an MDT in there, so every week all of those prescribing referrals go into a big MDT, of which there are a range of community partners. It is from that location that we've held the guided conversations, because, as I'll comment in a moment, you can imagine as the kind of social determinants start to emerge, you don't simply want to capture that. We want to be in a position to act on it and engage the wider team. So being based in that office with the wider MDT team has brought with it significant advantages. So giving you some more numbers of the 145 patients contacted to date. So far, 44, so about a third of those have accepted, the sort of full program, if you like, as in the full guided conversation, and then work through their social determinants. In terms of the outcomes of those conversations, again at a relatively high level, there were three key themes that sort of emerged. One was around dietitian and nutritional support. There was we have a full-time primary care network dietitian that we've ended up allocating part of her time do this project because unfortunately she has a special interest in diabetes. She's a UHCW dietitian that's seconded to our PCN and reimbursed under ours. So there's a strong nutrition and dietitian support need. The next was mental health. As you can probably imagine, those who feel they're experiencing either low mood or more significant mental health issues. And I mentioned earlier in the call, we've got a CPN that's embedded with our social prescribing team and a range of so Mind, for example, a range of community partners that are able to support those with mental health needs. And then the final one was around active lifestyles and sort of exercise and a desire to become more active. And I don't know if you're cited, but South Valley was one of, I think, about 6 PCNs across the ICB that were successful in a Think Active bid. So we're actually running our own healthy lifestyles program in addition to the kind of commissioned lifestyles programs from Coventry City Council. So we've been kind of internal referring patients into our healthy lifestyles program, and we've got 2 cohorts running. We're doing one of a Monday evening at 7:15 for working age people, and then one on a Thursday at lunchtime. And of the sort of 44 that have accepted so far, we've got 12 that are in a stream coming through our healthy lifestyles program. So it's a 4-session program, with a lead GP who's got a special interest in healthy lifestyles and a health coach. So I think what I'm trying to bring to life there is, with a kind of personalised care approach, the point is to run them through a kind of guided conversation to get these objective measures. It's then about agreeing a personalised care plan with them. That's documented with EMIS. The patients sent that thereafter. But also we've been very keen to identify, but also deliver interventions to these patients. I think we've chosen a really interesting and unique cohort. I think this particular age range, what we're finding is quite an unexpected unmet need in these diabetic patients of both what I'd call the social determinants of their disease around diet, exercise, the sort of lifestyle factors. That's essentially where we're up to right now.